when the process continues. If you have some mentally, you can do it day by day. The most important is to be strong day by day. That's why I take the decision to do your recommendation. I did my femur and my tibia. If I will do just femur, I will look unproportional. Entiendo que lo más importante es tú saber elegir un equipo que sea responsable, que no solamente piense en el dinero, sino que sea responsable, porque toda cirugía tiene su riesgo. Entonces, si tú, por ejemplo, escoges un equipo que no es responsable, una simple cirugía puede acabar en una complicación que puede ser fatal. Yeah, I know, it's different.
Yeah, and we stretch the legs also.
But it's no problem, I will fit it.
But I
would do a stitch by myself.
But bro, this is like this. Guys, welcome to our YouTube channel. So I have here great person from
Dominican Republic.
Greetings, many greetings to Dominican Republic. Eduardo, my brother, can we know a little bit about you? Who are you?
I'm Eduardo Veras. I'm from Dominican Republic.
So you are also a surgeon.
Yeah, I'm plastic surgeon.
Okay.
And I think that like plastic surgeon is very important. I think that my legs, it was shorter for my height. The most important, it was the proportion. When I talked to you, I was talking about my arms. Yes. I remember that you told me that I don't need it. You talking about doing quadrilateral.
Yeah.
I think that quadrilateral is a good choice for the proportional. The process is important that you have mentally strong. If you have painful, you thinking to stop the lengthening. When the process continues, if you have strong mentally, you can do it day by day. The most important is to be strong day by day. There is a time in the process, I remember that I was with my wife, that I thought to stop, cause the pain I was painful. Everybody is different, but in my case, some people have high tolerance to the pain, like that. I can say, some patient, for example, I do liposuction and he don't see anything. You know, in my case, discovered that I'm painful. And I have a time when I think to stop, but I keep focused in my goal.
You reached 9 point?
I reached 9.2.
9.2 centimeter. So your height right now should be 170, close to 180, right? 179.
Exactly.
Point something like that.
Exactly.
So the main question is right now, are you happy with the 9 centimeter in the result?
I feel great because I feel more comfortable with my new height.
That's the most important thing, bro. I mean, first of all, you should be really happy. I mean, not that what you reach. I mean, by the way, also your goal was from beginning to have the proportions. I mean, because we have some people who is caring about the height, about the centimeters, but you was like caring about the proportion. Eduardo, your goal from the beginning, because we talk also many times via video call, was not to reach a number of height, for example, 190, 185. You always talk to me, Sedat, I want to be proportionally. You always care about the proportion. So, and he asked me also, Sedat, I also want to do my arms, as you mentioned that. And I told him, Eduardo, look, you are a sexy doctor, you know, so you don't need to do the arms, because first of all, you need your arms, and you will be not happy if we also do the arms, because then we don't have really a great proportion again. When we lengthen the legs, he will be great, but when we lengthen the arms, we are back at the beginning. So now my question to you, because I told him, you know, I mean, you pay money here, it's great, okay, fine, it's my job, but you don't need it. It's my job as a human. So my question to you, are you happy that you don't edit your arms?
Por supuesto, me siento cómodo con haber aceptado el consejo que usted me dio, o sea, de haber tomado la recomendación que me diste, porque en el principio, como bien dijiste, quería hacer mis brazos. Sin embargo, yo soy cirujano y como cirujano yo necesito mis brazos. ¿Entiendes? Entonces, lo que tenía en mi mente en el principio era que si, por ejemplo, hacía mis piernas más largas, mis brazos se iban a ver más cortos y se iba a ver desproporcional a lo que realmente yo estaba buscando. En realidad lo que yo estaba buscando era proporciones. Y entonces si, por ejemplo, hacía solamente las piernas, mis brazos no, en mi mente yo estaba pensando que me iba a ver desproporcional. Sin embargo, después de ver los resultados finales, agradezco haber tomado tu consejo. Es por eso que recomiendo que tomen el consejo de los profesionales. Porque, por ejemplo, cuando yo decidí hacer la cirugía, yo pensaba que era más importante hacer los brazos y hacer, por ejemplo, fémur. Sin embargo, ustedes, por su experiencia, ya sabían con otros pacientes que solamente haciendo cuadrilátera era suficiente para lucir proporcional. I said that it's important to listen the professional. When I decided to do the surgery, I was thinking that if I don't do my arm, I will look unproportional. So when I saw the final result, I saw that you have reason. That's why it's very important to listen the professional.
People is thinking sometimes, oh, okay, I mean, they recommend quadrilateral because of they have benefits or other things. I mean, first of all, this is not because of benefits, guys, because yes, I mean, you can motivate the patients, but after 3 months, there's a result, a final result, which we stay behind of the job, and we don't want to regret any decision. So we have always choose the best for the patients, because at the end of the day, we will look each other, and also from our side should become the right decision to make both of us happy. In your case, it was the quadrilateral definitely a great idea, and arms not. So even if that is not a benefit to us, you know, like, I mean, to do your arms will be a benefit, but this is not something we are looking for. So we are looking for to see the patients happy, which you are right now, and that makes us automatically happy, bro. Thank you for your trust, by the way.
Gracias por tu recomendación, porque gracias a esa recomendación yo tomé la decisión correcta. Si yo hubiese hecho solamente fémur, y hubiese hecho, por ejemplo, fémur y el húmero, no hubiese lucido proporcional. Thanks for your recommendation.
Thank you, my bro. Appreciate it.
That's right. I take the decision to do your recommendation. I did my femur and my tibia. If I will do just femur, I will look unproportional. That is the important to always hear the professional. In my case, like surgery, sometimes some patients come to me and they say, do that surgery, please, I want more boobs, I want more breasts, but your body are not proportional. In my practice, I always try to do proportional. It's the most important in the anatomy of the human being, of the all.
So you are a surgeon, plastic surgeon.
I do everything. I do nose, I do breast, I do liposuction, I do BBL, I do liposuction in male,
Okay.
I do six packs,
Okay.
I do reconstructive surgery, I do oncology patients who have cancer.
Oh, wow.
I do everything.
Wow,
I do
okay.
everything in plastic surgery. Sometimes I have work with orthopedic. In the case who patient lose tissue, we can do.
I mean, plastic surgeons save definitely life, bro.
Exactly.
I mean, thank you that such a surgeons exist. Really,
In my opinion, is one of the specialties more complete.
I mean, if I'm coming to your clinic, it's not like what I wish. it's also your recommendation, right? Important.
Exactly, that is important. That una cosa es lo que el paciente quiere y lo que el paciente tiene en su mente, y otra cosa es lo que el paciente necesita. Esa es la parte importante, la parte humana, que el profesional tenga la decisión de recomendar lo más correcto al paciente, no pensando en el dinero, sino pensando en lo mejor para esa persona. The most important in a professional is to be able to do the right. One thing that the patient have in her mind. The most important is that the doctor be honest with the patient and do the correct.
You can lose everything, but never your face, never your personality. That's really important. And also, I remember, you know, we did when you was home, we did video call many times. So, and your wife helped you, and I told to my wife, "Babe, can you hold the camera?" We checked the proportions together. It was really great, bro, to share information.
2 times, we did 2 times. Because I'm not,
Well, for 1 hour.
Sure. Exactly, but one thing very important in the process, is that you have support. I think that I haven't did without my wife.
Mentally or
in everything.
Everything.
In everything, cause if you don't have during moment in the process that you are weak, and in that moment you need someone that be with you, that pushing, and that you can, you know. And very important to have a team professional. I have to know that you have a great team, bro.
Appreciate
you
it.
have a great team, good, the nurse, the nutritionist, physiotherapist.
Well, if you tell me that as a surgeon, it makes me really happy and proud, brother. Thank you. I mean, of course, nobody's perfect, but if you think like that, I really appreciate it. Muchas gracias. Muchas gracias. Muchas gracias. Thank you so much, bro. It makes me really happy and proud. We try the best. We try our best. Of course, it's a process. It's a hard journey. It's a, you know, as a surgeon, you know that also. But I really appreciate it. Thank you for your important words. It's important to me. Bro, we are lucky because you have a great wife. She's supporting you. I have also a great wife. She's always supporting me. It doesn't matter what kind of decision I have. She's always supporting me. Thank you for her and thank you for your wife as well. So you guys, you surgeons, are a really great, hard people. I mean, because not all of them can see patients like sleeping, humans like sleeping, and put something inside and see blooding. This is really not everybody's job. You should be a smart person and a strong person. So my question to you.
I know.
I ask also this to Dr. Halil, bro.
Go ahead.
I mean, you are putting bomb to people, but your pain tolerance is sensitive. Why, bro? This is, by the way, with almost all the surgeons. Why is the case? Why is it like that? Because
I don't know why. But now I can understand my patient. That process it will change inside, bro. I can now I can understand. I can understand more my patient when they feel pain and put in her place. This is a good experience, but I don't know why the doctor feel too pain. I would like to do surgery, Dr. Halil. To see, but I think that experience have a good part. When do you from that process, you will in the ending, you became in a different person. Stronger.
That's the advantage.
I every day maybe I feel the same pain, but every day I feel stronger. You know, day by day I feel stronger. If you ask me right now, I don't feel pain in any place. You know.
Wow. Okay. I mean, none of the pain can kill you now.
No. I haven't taken painkiller, but in the process it was too hard, bro. It was too hard. I don't go. But the most important is your mind and be focused.
Bro, I mean, my pain tolerance was also really less. Yeah, but if you see results, it pushing you to do the other one. And unfortunately, you had quadrilateral. I just started with my femur. So now I learned to fight with pains. But bro, I mean, you are a surgeon now. You know the pain. You can understand your patient. It makes me really happy.
Bro. Yeah, bro. Yeah, I can understand my patient now.
You know, Eduardo, I did liposuction as well. You know, it's your business in Istanbul. And bro, I was wake up. I was like this. I was wake up. I see directly results. It makes me so happy. You know, I didn't so like fat, nothing. But I want to stand up, just drink water. It was like, oh my God, I was blocked. And doctor came, you remember? And I told doctor, hey doc, I cannot move. He said, it's normal. Pain, come on, it's normal. But now, it makes me happy that as a surgeon you can understand your patient because, you know, yes, it's normal, the pain for sure, or even his reaction. But that moment, this is exactly what makes also special, like between me and Dr. Halil. He's surgeon, bro. He's shaking legs. He say, it's normal, but I know the feeling as a patient. No, it's not like that, you know. That's great.
Yeah, bro, yeah.
Bro, now I have a question to you. Is your surgeries hard or our surgeries?
I don't know, cause I haven't the liposuction, but to have six bones is hard, bro.
It's hard, right?
It's hard. Not for the bone. It's not for the nerve, for the muscle. And the difference in your surgery and my surgery is you feel pain in the beginning and the pain is going down. The pain is continuing. You know, when you still lengthening, you feel more pain until the end. What I knew about that process is that the pain never gone. You became strong, but the pain is the same from the beginning until the end. And it's important that the patient, when he come to do that surgery, be clear with that. You know, every patient is different. But the difference is that you can feel the pain, and the good thing is that you became strong. You know, but it's very different. In my surgery, pain in the beginning, going down. Usually the pain continues. The difference is that you became strong.
Yeah, but
You
one
know.
difference is, please, now I want to make every limb lengthening patient happy. Your surgeries and our surgeries is one thing is different. In your surgery, if you make nose, when I'm getting old, my nose can grow, right? All right, bro?
Yeah.
Also my ears can grow. So if you do liposuction, for now I have great body, but I can also gain weight. Isn't it? You can gain weight, right?
Yeah.
So, but limb lengthening surgery is forever. The height what we are doing is forever, bro. It doesn't matter how old are you, in which place you are, what you eat, what you do, you have the height forever.
Yeah, but I think that in all the process, you need to care your result. You need to care you invest in. It's very important to be a lifestyle.
Yes.
This is very important.
Bro, after my liposuction also, I told myself, hey, you pay money, you suffer, now you have to do. Since I did my liposuction, I'm doing sports. Every week I'm doing sports.
And you have to care what
Exactly.
you eat.
Exactly.
It's
It's not like, okay, I eat like chocolate and for 1 year and the next year I will do liposuction. It's not like that. I mean, surgeons can change life. Really thankful for the surgeons, also for you, bro. But it's also important that what the human is doing, you know. You as a surgeon, there's a three questions which I think almost all your patients asking you. Is the surgery risky? Also for us, the patients asking, is your surgery risky? Can I die? Can I lose my legs? So you are in front of me. You are the right person as a surgeon. And I'm pretty sure that your patients asking you that also. What you can answer for this question?
Entiendo que lo más importante es tú saber elegir un equipo que sea responsable, que no solamente piense en el dinero, sino que sea responsable, porque toda cirugía tiene su riesgo. Entonces, si tú, por ejemplo, escoges un equipo que no es responsable una simple cirugía puede acabar en una complicación que puede ser fatal. En el caso de la cirugía de pierna, del alargamiento, yo estoy consciente que esta cirugía, yo como doctor, tiene su riesgo. Sin embargo, si se toman las medidas del lugar y tú tienes un equipo que le da soporte, que le da apoyo desde el principio hasta el final, la cirugía va a ser un éxito. Toda cirugía puede tener una complicación, incluso las cirugías que sean bien hechas. Hay condiciones que no dependen del cirujano ni dependen del médico, sino son situaciones que pueden suceder. Aún el cirujano haga la cirugía bien, aún el paciente esté en las mejores condiciones, el paciente puede tener una complicación. Sin embargo, en el caso de la cirugía plástica también es lo mismo. Por eso es muy importante tener un equipo que esté bien preparado. I think that the most important in that procedure is you choose the correct doctor, the correct team. Because every surgery have your risk. You know, you can stay a nail and you can have a complication. The body is different in each people. You like that or can do a good surgery and the patient be healed and they can have a complication. Never know. If you like that or said that you don't going to have complication, you are lying. Because everybody is different. It's different. There are things that don't depend even the doctor, even the patient. The most important is to have an excellent team that it can fit the complication. The complication happen, and the most important is that you can fit, you can solve that complication, and you can respond about that complication, and you have a team that be watching the process until you heal.
Yeah, thank you. Because people are thinking like it's 50-50. I can die.
No,
maybe not.
this is lie. There is patient that you do the best for that patient, and the patient can have a complication. There is patient that don't do what I have to do, and they have a excellent result. This is not like mathematics.
Thank you that you are mentioned as a surgeon, by the way. Since when you are a surgeon?
10 years.
Wow.
From the general surgery, because I'm general surgery first, and after I did plastic surgery and I did reconstructive. I haven't did fellowship, but the most important is to care your patient.
I mean, Eduardo, for example, I don't know how you do this, but when we have a problem, complication, even it's coming from you because you fall down, you damage the system, we have to change the nail or replacement. We are doing that for free, I mean, we are caring about the patients and behind of the job. Of course, not every surgeon is doing that, but we are doing this because this is our, this is our job. I mean, we are doing like this way. So, but my question to you now is, you are a plastic surgeon, so are you happy with your scars, to be honest, as a plastic surgeon? Now I'm really, this question is really, what you will say about the scars, bro?
I think that my scar, the process is not finished. Mm-hmm. The scar it can take one year.
1 year, yeah.
1 year. And they will improving every day of your life because the skin, it will change every day. But I think that it will be.
It's not so, you are not so happy? Okay, he answered me. But bro, your scar is different, like you are doing magic scarring. You close the skin from inside, Eduardo, right?
Yeah, I know, it's different.
And we stretch the legs also.
But it's no problem, I will fit it.
But
I would do a stitch by myself.
But bro, this is like this. But your femur is good.
Yeah,
Tibia is looking just a little bit strange.
Yeah, but this is normal.
Yeah, of course.
Normal.
I mean, this
is normal. It's normal. That color is normal.
Yeah.
With the dye, the color it will change.
Yeah.
It's normal. It's very important. Don't take sun.
Yeah. Ah, okay.
If I take some, it will stay black.
Ah, okay.
It's very important. Don't take some in the first day of the sky. It's not mature.
Okay, thank you for the
Yeah.
information, bro. I mean, look, normally it's not so. This is the nail entrance. This is the screw which we put lock the nail, and also here the screw. But of course, like your job is different, bro. You are doing great scarring. I mean, you open the nose. You know like you put something in the body. I don't know. I'm happy with my scars, but of course, like my story is also different.
And it doesn't matter for my scar. I'm a man.
Again, thank you. For me, it's really important that as a surgeon, you choose us for the limb lengthening surgery, and that makes me really happy and proud at the same time. I'm really, really happy. My question to you now, you can also explain in Spain or English, it doesn't matter. Are you happy with your choice to Livelifetaller as a surgeon? What is your opinion here?
En mi opinión, lo más importante, como dije al principio, es elegir un equipo que tú te sientas confiado. Yo en uno de mis videos, en mi práctica, dije que tú tienes que sentir esa conexión con la persona que tú vas a poner tu vida en sus manos. Si tú no te sientes cómodo, no te sientes seguro, no deberías operarte con esa persona. En el caso de Livelifetaller, yo me sentí cómodo, vi sus resultados, vi que cuando te llamé tomaste el teléfono y me sentí confiado. Fue una decisión que no se toma de la noche a la mañana, se toma tiempo, se va madurando esa idea y siento que tienes un buen equipo, el cual hay que cuidar. También es una recomendación que podría hacer, es que los pacientes que vengan, en el caso de alguna cirugía, si pudieran tener un acompañante sería bueno, que esté allí quizá 24/7 en el caso de alguna cirugía. Por ejemplo, en el caso de la cirugía de fémur y tibia. En el caso de que sea solamente una articulación o un solo o dos huesos, sí pudiera ser independiente porque tienes un equipo de soporte. Pero en el caso de alguna cirugía, pudiera recomendarte, por mi experiencia propia, que viniera acompañado. I will try to do in English. I said that the most important is that do you feel comfortable with the thing that you choose? It's the most important. If you don't feel that connection with your doctor, with your team, don't do the surgery. I feel that connection when Livelifetaller from the beginning, and I feel more comfortable when I call you and you ask my call. You take your time to explain me. That made me feel more comfortable, more sure that choose to do my surgery. We are talking about that I put my life in your hand. If I will do some recommendation, is that in some surgery, you allow that the patient comes with some people that don't come alone. In the case the quadrilateral, if you can allow that the patient come with a family, it's important. In the case that you have just two bones, for example, when you do just femur or do you do just tibia, you can be alone. But when you do quadrilateral, I recommend that the patient have
Someone with him.
someone. It's important. You know, when you have six bone broken, it's not the same that if you have just one. About the method, do you know that the Precice is more comfortable? When I come to you, do you explain me clearly?
Yeah.
I remember that the Precice is more comfortable. You can take a shower soon, but we know that the Precice is weak, making a comparison with long method. If you have long method, the nail is strong. It's strong. That's right. Every method have exactly
His advantage and disadvantage.
exactly.
Yeah. But your decision about the quadrilateral Precice was good, right?
Yeah, it's a good choice because I have someone with me. But if I will come alone, it will be more difficult for me. Okay, and more risky because the long method is strong. The Precice.
By the way, guys, he asked me, Sedat, can I do next week surgeries? I told him, why not? Out respect. I mean, you are a good surgeon. By the way, bro, I check also your Instagram and, I follow you. You also follow me, right?
Yeah, bro.
Yeah. Before.
In Instagram and TikTok and YouTube and everything.
Great, you are doing a great job, bro. You are really a good surgeon.
Thank you, I appreciate it.
Well, I wish you the best for your future. And thank you for trust in our hands, in our company, Livelifetaller. I really appreciate it, brother. And guys, Dr. Eduardo is finished. He have a good bone healing. He's in a great condition. Just the muscle, soft tissue is weak a little bit, but it's a normal process, as a surgeon also. And yeah, I wish that I can see your recovery videos. And I'm pretty sure after, let's say, 3 weeks, 4 weeks, you should be able to start with your surgeries and change lives also, continue to change lives. I'm sure that many patients waiting you, bro, right?
Yeah, bro.
Yeah, bro. Yeah, I mean, good surgeon, of course. So, Eduardo, thank you again for your trust, brother. And your words was really important to me as a surgeon.
Thank you, my bro. Thank you. See you soon.
See you soon for the nail removal. And guys, thank you for watching the video. Just important information. We have also a lot of surgeons, to be honest, but of course not with every surgeons we are doing videos. Thank you that you share your story with us. And yeah, see you in the next video. Thank you. Greetings from Istanbul to wonderful Dominican Republic. What is I love you in Spain?
Te amo.
Te amo, Spain.
Te amo.
Te amo.
Dominican Republic.
Dominican
Republic. It's Dominican Republic.
Yeah, and we say German, Dominikanisches Republik. It's so strong. Yeah, Dominican Republic. Greetings to wonderful Dominican Republic. I will visit you, bro, with my wife. I will come and
I will be waiting for you.
Yeah, thank you so much, bro.
See you.
Guys, see you. Bye-bye.
See you soon.
Thank you, Eduardo. Thank you for a great video.